Hi everyone, I'm Vicky, Principal Dentist at Torrs Park Dental Practice. Today I'm going to show you guys how to put a temporary filling in. I've had a few requests for it, so we're going to make a video on that. It depends on the size of hole that we're filling as to how much temporary filling material we need. So we've got two demonstrator teeth here. One's quite a big hole, and then the other which has just got a small bit where the corner's missing. Okay. So depending on the size of hole, depends on how much of the material you need to dispense. Some of the materials come in tubes like ours does, just like this, and others come in little pots which you just kind of flip the lid on, take a bit out, and then you're ready to do temporary filling. The trick with all of it is when you dispense the material, make sure you either put the lid on nice and firmly and tightly to stop the air getting to it, or clip the lid back over if it's a tub, just to stop the whole of the temporary material from setting. Okay. I think if you've got a big hole, the best thing to start with is a pea-sized amount. If it's a smaller hole, aim for more like a petit pois size. So vary the amount of material depending on the size of the hole. We need to try and dry the surface of the tooth as best we can. So a good thing to use for that is some cotton wool if you've got it, and also a nice suck of air over the tooth just to clear any saliva and dry it as best as you can. So kind of over that area, and that should help to dry it a little bit. When it comes to placing the material, a lot of these packs have got applicators with them. I don't actually think that they're that useful. I think it makes it a lot more fiddly. So the best thing to use as one of the favourite instruments in dentistry, digit number 1. Alright, I'm going to make dentists of all of you at the end of this. So to fill the bigger hole, get your pea-sized amount, place it directly over the hole, and then really push it in so that we're really filling that void. And you can see all that excess just squidges over the top. Then we need to remove the excess, which again we can just do with our finger. Okay, and then you may want a bit of a tissue because it gets a bit messy. When it's like this, you then want to close the teeth together, bite down nice and hard, and give everything a really good grind around, say like that, just to make sure that the teeth meet properly and that we're not going to get in the way of any forces of the jaw going one way or the other when eating. This is going to make sure that you can eat comfortably. It doesn't make the tooth tender because it's too high and you're bruising the ligament that the tooth sits in. And also that the temporary filling is likely to stay there for longer, because if you get the right size and shape, you're less likely to knock it out with the bite. And then after you've done that, you can just tidy it up a little bit more if you wish. And there you go. You've done your first filling as a dentist. The smaller holes, or ones on the side, again, what you want to do is get your smaller amount, place it onto the side and really push it in. Okay, shape it round if you can, and again remove any excess. If it is in the way of the bite, you again want to just close the mouth together around there and make sure that you can get your teeth together okay. And there we go. And then wipe off any excess. It's as easy as that. Hope that is helpful. Any problems, give us a shout, and I hope you're all staying safe and taking care.